What the coroner found. Inside Michael Jackson's final medical record. For years, the public image of Michael Jackson leaned on two extremes. Either he was a fragile, wasting figure barely able to sustain his own body, or he was a mystery wrapped in surgical bandages and rumor. When Los Angeles County medical examiners opened his body on June 26, 2009, the day after his death, neither picture held up entirely. What they documented instead was something stranger and, in places, far more ordinary than the tabloids had trained the world to expect. So before we get into the specifics, ask yourself this. What do you actually think killed Michael Jackson? A weak heart? Years of drug abuse eating away at his organs? Keep that guess in your head, because by the end of this, you may find the real answer is almost the opposite of what decades of headlines prepared you for. A body that didn't match the headlines. The first surprise came before investigators even reached his internal organs. At 50 years old, Jackson's frame told a story of discipline rather than decline. His body mass sat within a healthy range. He carried very little body fat. This alone contradicted years of paparazzi photography that had painted him as skeletal and failing. His heart, weighed and inspected in detail, came in at roughly 290 grams, an entirely unremarkable figure for a man of his height and build. The valves were intact. The muscle tissue showed no signs of the kind of damage examiners typically associate with long-term substance abuse or advanced heart disease. There was no meaningful plaque buildup blocking his coronary arteries. In plain terms, the organ most people assumed had simply given out was, according to the report, working exactly as it should have been. That single detail turned out to matter enormously once lawyers got involved. If Jackson's heart had already been compromised, the defense in the criminal trial that followed could have argued that a pre-existing condition, not any drug administered that night, bore responsibility for his death. The autopsy closed that door. Whatever happened to Michael Jackson in his final hours, it wasn't his heart failing on its own. The one organ that told a different story. Not every system came back clean. Jackson's lungs showed chronic inflammation and reduced capacity, the kind of finding that could plausibly have left him winded during activities that shouldn't have been difficult. An anesthesiology specialist who later reviewed the case for the press called it an unusual condition, one that had likely been developing for years rather than months. Here's the twist worth sitting with, though. As serious as that sounds, the report was explicit that it didn't rise to the level of a contributing cause of death. His lungs were compromised, not failing. Congested, but still doing their job day to day. It's a reminder that a body can carry a real medical problem for years without that problem being the thing that ultimately takes it down, which raises an uncomfortable question. How many chronic issues do any of us walk around with quietly, without ever being pushed toward the extreme events that would finally reveal them? Ordinary wear, extraordinary body. Beyond the lungs, the rest of the skeletal findings read almost mundane. Arthritis in his lower spine, stiffness in several finger joints, mild plaque buildup in the leg arteries. A reviewing physician described the overall picture, arthritis aside, as relatively good for his age. These were the kinds of degenerative changes that show up in medical charts for plenty of people well before they hit 50. Nothing dramatic, nothing that pointed toward his eventual death. It's almost strange to include something this unremarkable in a report otherwise packed with revelations. But that's precisely the point. Strip away the surgical history and the spectacle, and parts of Jackson's file could belong to almost anyone crossing into middle age, confirming a condition he'd defended for decades. One of the more quietly significant findings involved his skin. Since the early 1990s, Jackson had insisted that his changing complexion came from vitiligo, an autoimmune condition that destroys pigment in patches of skin, rather than any deliberate bleaching. Plenty of people doubted him publicly for years. The autopsy settled it without ambiguity. Examiners documented depigmented patches spread across his chest, stomach, face, and arms, each bordering areas that had retained their original color. His legs showed the same striking contrast, deeply pigmented skin sitting directly against pale, affected patches. It matched almost exactly the pattern he had described in interviews going back decades. This time, though, it wasn't just his word. It was written into an official coroner's record. Doesn't it make you wonder how many public figures spend years defending something true, only to have it accepted as fact solely because a medical examiner eventually confirmed it? The wig, the hairline, and what was underneath. Then there's the part of the report that had nothing to do with his death but everything to do with how carefully his public image was engineered. Jackson's natural hair, examiners found, was sparse, with visible balding across the front of his scalp. Before the autopsy could proceed, staff had to remove a wig that had been attached to his head. Much of the scarring on his scalp traced back to the severe burns he suffered during the infamous 1984 pyrotechnic accident while filming a commercial, injuries that required multiple rounds of reconstructive surgery afterward. Reports at the time suggested he kept what remained of his natural hair trimmed close, simply so it would sit flat enough to disappear beneath the hairpiece he wore in public for decades. But the scalp work didn't stop at surgery scars. The front portion of his hairline had been permanently tattooed a dark shade, designed to blend with the edge of his wig so that even a shift in lighting or a slipped hairpiece wouldn't expose bare skin underneath. It's a technique now known in cosmetic circles as scalp micropigmentation, though back then it would have been a far more obscure procedure. Combined with tattooed eyebrows, tattooed pink pigment along his lips, and fine tattooing around both eyelids, the picture that emerges is of a man who had spent years building a face that could survive close-up scrutiny without daily maintenance. None of that would have been visible from an arena seat. It only became apparent once examiners were working under direct clinical light, with the wig removed and the makeup gone. A career written in scars. Cosmetic tattooing wasn't the only physical record of decades in the public eye. Investigators counted at least 10 identifiable surgical scars across his body. Behind both ears, beside each nostril, along the bridge of his nose, on his neck, one shoulder, both wrists, and a knee. None of them were recent. Together they mapped a timeline of procedures stretching back to the late 1970s, long before most of the public speculation about his appearance had even begun. If you had to guess how many surgeries a person needs to maintain a single, consistent look across 40 years of intense public scrutiny, would double digits have been your number? For Jackson, evidently it was. What the needle marks revealed. Away from the cosmetic history, another pattern stood out. Puncture marks scattered across his arms, shoulders, hips, thighs, and ankles, some fresh, many long-healed. The spread was wide enough, investigators concluded, that a large number of these injections were unlikely to have been self-administered. Additional marks near the creases of his elbows and the backs of his hands suggested repeated intravenous access over time, consistent with a long-running pattern of injected medication rather than a single treatment episode. Separately, his knees carried their own distinct puncture history, tied to documented knee surgery and periodic anti-inflammatory injections. Forensic notes also picked up early degenerative joint disease around the kneecaps, likely the physical cost of decades performing routines built around sudden, high-impact movement. It doesn't take much imagination to connect that finding to a specific dance move that made him famous worldwide. Taken as a whole, these marks weren't about any single drug. They pointed toward how deeply medical intervention, of one kind or another, had become woven into his daily routine long before the final night of his life. An empty stomach and a telling clue. When examiners opened his stomach, they found only a small amount of dark fluid, no more than a couple of ounces. No pills, no capsules, no solid trace of anything swallowed. Later testimony would confirm that a sedative found in trace amounts in that fluid wasn't taken orally in any meaningful dose, since the drug in question barely absorbs through the digestive tract in the first place. That single detail matters more than it might seem. It meant the drugs found in his bloodstream almost certainly reached his system through injection, not through swallowing pills, a distinction that shaped the entire direction of the criminal investigation that followed. Organs that refused to confirm the rumors. If there's a theme running through the internal examination, it's contradiction. His kidneys, weighed individually, showed smooth surfaces with no scarring, no cysts, and no stones. His liver, a soft, healthy reddish-brown, showed no cirrhosis, no fatty buildup, and no trace of chronic damage typically associated with long-term substance misuse. His bladder contained a small amount of clear urine with no sign of infection. Organ by organ, the story stayed consistent. Nothing here was breaking down on its own. He did carry an enlarged prostate, a condition so common in men over 50 that it barely counts as noteworthy, and one that had reportedly made urination uncomfortable for him in his final years. It changed nothing about his cause of death. If anything, it's a small, almost humanizing detail buried inside an otherwise extraordinary report. A reminder that behind the surgeries and the scrutiny, parts of his medical file looked like almost any other man his age. Injuries from the attempt to save him. Some of what examiners found didn't happen before his collapse at all. Fractures across his sternum and several ribs, along with bruising on his chest, came entirely from the resuscitation attempt itself. Sustained manual chest compressions performed first by paramedics and then, for nearly an hour, by staff at the hospital where he was taken. That kind of injury is common, almost expected, when compressions are performed with the force needed to have any real chance of restarting a heart. A last resort attempt to restore circulation using a mechanical pump was also tried and, according to later testimony, had no effect. These weren't wounds inflicted before his death. They were evidence of how hard the people around him fought after it had already begun. The room itself. Investigators who walked into the rented mansion where Jackson died described something closer to a makeshift clinic than a bedroom. An oxygen tank stood nearby. Boxes of catheters and disposable needles sat within reach, alongside alcohol prep pads scattered across surfaces. Several empty bottles, once containing orange juice, were found around the room, along with a plastic mattress liner and prescription bottles covering conditions ranging from anxiety and insomnia to depression. More than a dozen vials of a fast-acting anesthetic were recovered from the scene. It painted a picture less of a single reckless night and more of a long, unresolved search for sleep that had spiraled well past anything found in a typical home medicine cabinet. What the toxicology report actually showed: testing on his blood identified an anesthetic agent alongside a sedative as the two substances primarily responsible for his death, with several additional medications, including other sedatives and a topical anesthetic, present in smaller amounts. No illegal drugs turned up anywhere in the results, a fact that on its own reshaped how the case was framed. This wasn't a story about street drugs. It was a story about legally prescribed medication used in a setting no hospital would ever have permitted. The concentration of the anesthetic in his blood matched levels used to sedate patients undergoing major surgery, not levels appropriate for treating insomnia in a private bedroom. One expert who reviewed the case noted there were no documented instances anywhere of that drug being used this way outside a monitored medical setting, given how quickly it can suppress the body's own drive to breathe. His personal physician told investigators he had given a dose far smaller than what the toxicology results implied. Investigators were skeptical. Would you have guessed that the drug ultimately linked to his death is one most people only ever encounter, unknowingly, while under general anesthesia for surgery? How the coroner ruled. The Los Angeles County Coroner's Office classified Jackson's death as a homicide, listing acute intoxication from that anesthetic as the primary cause, with the sedative effect of additional medication listed as a contributing factor. Central to that ruling was the finding that the drug had been administered without any legitimate medical justification. The chief medical examiner later testified that even under the defense's own theory, one suggesting Jackson may have taken an additional dose himself while briefly unsupervised, the ruling would still stand as homicide, since lethal medication had been left accessible and unmonitored in the first place. It's worth pausing on what that word actually means in a forensic context. A homicide ruling simply states that another person's actions caused the death. It says nothing by itself about intent. That distinction is exactly what opened the door to an involuntary manslaughter case against his physician, rather than anything more severe, separating fact from the story that spread first. In the days immediately following his death, early reports claimed his stomach had been packed with partially dissolved pills, the classic image of a desperate, last-minute overdose. During the criminal trial 2 years later, that theory was raised directly, only to collapse once forensic toxicologists explained, plainly, that the anesthetic in question is essentially ineffective when swallowed. No pill residue existed anywhere in his digestive tract. Under cross-examination, the examiner confirmed he had specifically checked for exactly that and found nothing. It's a useful reminder of how quickly an unverified detail can calcify into public memory long before the actual evidence ever catches up. The fuller picture. Put together, the report doesn't describe a man whose body was failing him. His heart worked. His kidneys worked. His liver worked. What ended his life wasn't years of hidden illness catching up with him. It was a single, surgical-grade dose of medication, administered outside any setting equipped to handle what that medication can do, with no one monitoring him as it took effect. Everything else in the file, the tattoos, the scars, the wig, the decades of small procedures, tells a separate, quieter story. Not about how he died, but about what it apparently took to maintain an image under that level of sustained public attention for 40 straight years. So here's a question worth sitting with after everything you've just heard. How much of what we think we know about a public figure's health, or their death, comes from actual evidence, and how much comes from a story that simply got told first and loudest? If you found this breakdown useful, let us know which details surprised you most, and stick around for more deep dives like this one.